after the vaccination? What precautions should I take? Do I need to take a vaccine? How do I make appointments? And if I had a COVID 19, should I be vaccinated? Who is eligible for vaccine? And many more. We have invited four very well known and expert physicians to educate us and ease our anxiety. Let me introduce you to our first guest speaker, Dr. Nancy Patel, triple board certified physician in internal medicine, pulmonary medicine, and critical care medicine. Her specialty is in pulmonary and critical care medicine at the Rowan County Memorial Hospital, Clinton, South Carolina. Next, we have Dr. Meenu Jindal, who works as internal medicine faculty with Department of Medicine, Prisma Health, and USC School of Medicine, Greenville. Her passion is to teach students and residents. She also provides disease management skills to the patients with diabetes, hypertension, and other chronic diseases. Our next guest speaker is Dr. Prerna Jain Roth. Is a board certified in internal medicine. She is a specialist in infectious disease with Prisma Health Greenville. Last but not the least is Dr. Vinita Srivastava, who is a board certified and specialist in internal medicine and sleep medicine. She has been practicing for last 25 years in Greenville, South Carolina. Dr. Vinita Srivastava is also going to be a moderator for this panel discussion. Without further delay, let me hand it over to Dr. Vinita Srivastava.
Thank you, Viju. And thank you to IAG and the John Snow Society and the ASMA Society, I think. And we are missing a young man who was the originator of this idea. It was would-be medical doctor Mohit Gandhi, right? He was the one that thought of this idea, and he's not able to join us on the panel, but I hope he is surely in the audience due to some health issues. We hope for his recovery, speedy recovery. Thank you, Mohit, for arranging this. And the most important people in this is Sanjay Tellur. His hard work is what leads to this today, right? He championed the cause of this and got in touch with me, and I picked out this august group of young ladies. What a time in medicine that the specialist speakers are all women. That's remarkable. But thank you, ladies. Nancy, I know you see patients with COVID-19 actively in the ICU, in the outpatient settings. You're following up on people that have these long-term consequences. I couldn't think of a better person. Prerna, infectious disease, my gosh, this is the star field to be in this decade. So we were so glad you could join us, Prerna, with all the information from Prisma, and that's a big healthcare system for us in the upstate. So you're bringing us information from very good sources. And Meenu, you are training the next generation of doctors. So you are well versed in the art of teaching, convincing. So I thought nobody better than you. So without much ado, let's get started. Yeah. So this pandemic has been devastating, right? This has changed our lives. This last year or 12 months have been a roller coaster. We were in panic mode in spring. We went through the hope of in summer that things were getting better. Then we had the resurgence and a lot of lost lives and livelihoods, and a lot of people that overdosed on drugs because of the situation and the lifestyle changes we had to make. And finally came hope in December, January. And with hope, now we're finally rounding off into a period where there is hope, there is fear and anxiety. Hope because we know if we all band together, we probably will be able to knock this out. Fear because we worry about the resurgence, we worry about the variants. Anxiety because there is that eternal question, will people get vaccinated, right? Will people get vaccinated? That's a big question. Now, we all have a part in solving the fear, the anxiety, and aiding and uplifting the hope. So Sanjay, you're doing your part. IAG, it is doing its part. The experts here on the panel are doing their part. Now, you people in the audience have to come through and do your part. Because I know the people we are talking to today are not the ones that are vaccine skeptics. I don't believe that. I believe you can be people that will go convincing another 10 people to get the vaccine, right? That is our hope of what we wish to achieve today. But if you have doubts and if you are scared, we're here to reassure you. And we know some of you have sent in questions and we will be answering those questions. But first, let's get an idea of where we are in this pandemic, right? Nancy, um, where are we in this pandemic? Is this the tail end or is this a resurgence that we are facing?
So, like you said, we've just had a pretty rough year, and in the hospital right now, we are actually seeing a lot less cases. So it's really nice to see that we are actually on the downtrend, and the percent positivity rate in South Carolina is a little over 3%. So that's excellent as well to see that compared to some months that we've had in the past. So I think we're not technically completely out of the woods. We still have a little while to go just because of the vaccination rate. We have a long way to go before we reach herd immunity as well. I'm hoping that we don't have a resurgence, but that's always possible with the variants out there. And if we are a little bit more lenient with social distancing or not wearing our masks, I think that's easily possible to happen again in the future. Hopefully not at the rate that we've had in the past, though.
I do want to bring the focus back to the upstate South Carolina. We know we've talked about the United States and the cases going on. Minu, would you tell us what are you seeing in upstate South Carolina, Greenville, South Carolina in particular, and state of South Carolina itself?
Yeah, sure, Vinita. So honestly, just agreeing with as Dr. Patel said, and you mentioned earlier, definitely lower, much lower percent positivity and the rates of infection. And I would probably bring in my ID colleague and expert here to mention about those numbers as well, Dr. Roth. So in the outpatient setting, we're definitely seeing much, much lower positivity for sure from my end.
Yeah. There was some the stats that we can probably go over at this point. Sanjay, if you would like to put up the stats, we can take a look at that of the number of cases in the entire country, if you have it. Otherwise, what I am seeing, I will tell you, what I'm seeing as an outpatient is definitely there was significant number of cases we saw. People were panicked. People thought they had COVID-19. So there was a lot of that happening. We're seeing less of that happening, but also the stats concerning the plateauing of the numbers were hanging around the 50, 53, 54,000 cases a day kind of number bothers me because we were dropping quite nicely. That I believe is a source of concern. But for South Carolina, we've had 539,000 cases and close to 9,000 deaths. So here are the stats that I was looking for. If you see the number of cases in the United States is up there. And
I believe these are the vaccination rates, Dr. Srivastava.
Oh, sorry. Yes, I apologize.
The current numbers, I believe there's 29 million cases in the United States and about 123 million worldwide. And then
I agree.
We have about 541 deaths total here in the United States.
Right. Sanjay, this slide pertains to the vaccines, but that's good. We will use this slide in just a little bit. So now that we know how the scenario is all over the globe, we know what the situation is in the United States and here. Dr. Roth, would you like to talk to us about these new variants? Because that's the hot topic. There's so much information about them to the point where it is unclear what the information is, right?
Right, exactly. So great question. So variants, you guys know that variants, it happens whenever DNA, RNA replicates, and COVID is replicating like crazy. Like we have all these cases and everything. So every time a virus replicates, it has a chance to mutate. And so there are actually thousands and hundreds of thousands of actual variants. So these 4, that are in the news are variants of concern, which means that they have some mutations, and these 4, actually, they're all in the spike protein, which is what all the vaccines are targeting and what our bodies, build antibodies to. Now, even the spike protein is actually very huge. So there are lots of different mutations that can happen in the spike protein that don't actually affect the viruses, like transmissibility or mortality. So thankfully, and just to backtrack just a touch, the goal of a virus is to live forever, right? So over time, a virus in general becomes more transmissible and less deadly because it wants to keep mutating. So the natural evolution of viruses is to mutate and become more transmissible and cause less severe disease. Now that doesn't always happen, but most of the time that's what's happening. So all 4 of these variants, like the UK, the South African, the Brazil, and then the California variant, there's actually a New York variant, all of these seem to be more transmissible in the community. However, there is no evidence currently that they have more severe disease that I know of, and please correct me if I'm wrong, but in general, they're just causing the same disease or less severe disease that the initial COVID virus caused. So that's the good news. And in terms of specific things, does that answer the question, or is there more specific?
No.
Okay.
I just want a little bit more. How do you think these variants will impact what's going to happen to us in the next 4-6 months?
So they will cause probably more numbers of cases, but honestly, the vaccines do have activity against all 4 variants. How much efficacy is yet to be determined. Like Pfizer and Moderna have equal efficacy against the UK variant and the Brazil variant, the South African one, a little less coverage. But in general, I think we'll have more cases periodically, but as soon as everybody gets vaccinated, then even the variants hopefully will not cause more disease. But I don't think we'll have more hospitalizations or things like that in general.
Oh, good to hear that. What about you, Nancy? Are you feeling the same kind of feeling that Prerna is feeling about these new variants?
Yes, I do agree with that. Just because the data right now, that's what we're seeing is, and then we don't see the surges in the hospital like we had before. And remember that, these variants are in the community, so you don't know which one you have because you're not getting tested for that particular variant. So you may have had one of the variants and you just don't know. So it definitely is in the community. And I don't think that it's as severe because the vaccines are here now.
Oh, good. Now, just in case if anybody that we know does end up getting COVID-19, although the numbers are going down, that's good news. Nancy, is there new treatment options? Give us hope, because March of 2020, we were despondent. What do you think today? What do you think of the treatment options?
Sure. So back last year, we were pretty much throwing everything we possibly could. And I think now we understand what's working well and what's not. And I think there's more targeted therapies in the inpatient setting, especially. We've been using steroids, and we've seen that has really helped. As far as remdesivir and plasma, I think trying to find the perfect timing to give those 2 types of treatments is the next challenge. We've seen some benefit, but maybe not as much as we initially had believed. So I think moving forward, you may see some institutions removing that or not using it as often, just because you may be out of the time window for when those treatments are recommended. So I believe also that remdesivir, along with certain other agents, may be something that is being looked into as well in combination. But for right now, they are shying a little bit away from use of remdesivir just because of the timeline that patients present to the hospital. Usually with COVID, you're looking at 7 to 10 days of worsening of symptoms. So by that time, you may be out of window for remdesivir, and as well as the plasma, because most of the time you're already developing antibodies. So is your immune system developing just as much as you would receive from convalescent plasma? that's something that we don't know. So right now, those are the two things that we have seen a little bit of a change as far as treatment options. And monoclonal antibodies are really not being used much in the inpatient setting for the same reason that, maybe your body's already mounted the response and it's not as helpful. Oh, and one more thing is prone positioning. I know there's a lot of data coming out with that. So if your physician or provider at the hospital does ask you to prone position or lay on your stomach, please do take that advice seriously. I know it is a struggle for some of my patients because they're tired, they're not feeling well, they can't breathe, but I've noticed somewhat of a significant difference from those that actually do it versus those that aren't able to do it as much.
So from what you're telling me, the drug options are there, but we're far more educated as medical professionals how to treat it, but there's really not a lot of chemicals that we have at our in our hands, really. So you're telling me prevention is the best part of cure. You're making that point, yeah. And the prone positioning, yes, very interesting. That a prone positioning would help, and surely emphasizing that is good. So, Prerna, would you like to add anything to the treatment in case if one of us should get COVID? Why should I be optimistic that when there's no more chemicals? Why do you think my outcome is going to be better?
Well, because we have really good supportive care. Doctors like Dr. Patel and the ICU docs have really done a great job at vent management and steroids. So I think the mortality rates have just plummeted. There are a lot of compounds in research. So currently, yes, there's not, other than steroids really, and the remdesivir within 7 days, but there's a lot in research. And I think on the horizon, we'll have true antivirals that will be effective. And the good news is, in general, COVID overall, people do well, right? The mortality rates are overall low in general. I know every death is extra, but it's not, not anything to panic about. Most people do really well. Yeah.
Good, thank you. Let me ask Minu this question. Minu, you and I probably see the person way before Prerna or Nancy probably see them, right? This is the patient that has called you and said, I was exposed. That's one scenario where we see there's a lot of panic. I've been exposed. What do I do? Then there is that second patient we see that where not only is it exposure, but now they have symptoms and we have to send them for testing. Then there's that third patient who's been tested and is positive and now requires some kind of guidance on what to do. So any thoughts on how would you suggest for any
that's a great question. If we can. Yeah, sorry, Vinita, my internet was a little out. So yeah, I think that's a great question and great time for discussion about outpatient treatments, right? And I think I'm sure you probably have a lot more experience in that than I do. So to your point, when a patient presents with symptoms and tested positive, we have those monoclonal antibody infusions now available that we can give to patients, preferably, within a few days of positive testing. And I think those have shown great promise in the literature. So to Dr. Patel and Dr. Roth's point, there's so many options in the inpatient setting, but the good news is that even when the patient presents to physicians like us in the outpatient setting, we have the option of treating them as an outpatient and actually keep them out of the hospital.
I agree. Since I do outpatient medicine, I do come across all those three scenarios. Of course, reassure is the number one thing. Panic never helps anything. It never helps anything. So, of course, if the person thinks they've been exposed, you advise the due testing and isolation and whatever needs to be done. But the scenario where I feel help is needed is when the patient's gotten it, the symptoms are started, and they've tested positive. So that's where, if you remember what Nancy said, she wants the patients as soon as she can get, right, in the hospital. But we don't want to send everybody to the hospital because they would be overwhelmed. So that's the art of what the outpatient physician and the patient does. So we've got to stay shall we say, anxiety free, do the things that we have to do, monitor for the red flag signs of things going south. If your O2 is dropping, if your blood pressure is dropping, if your heart rate's going up, or if you're just not comfortable, you're getting confused, you can't think, you don't feel right, you're coughing more and more, you're coughing up blood. These are red flags. You should contact your doctor, somebody like me or Minu, or any one of us that practices outpatient medicine, and you would tell us the symptoms, and we would make a judgment. Are you mild, moderate, or severe? And if you happen to be somebody that we think qualifies for the monoclonal antibodies that Minu was talking about, we will send you to Prisma. In the upstate, Prisma is the one that's doing it actively. We would send you for infusion of the monoclonal antibodies, and we hope to see you recover. Then obviously, if it's not severe enough to go to the hospital, then we're going to advise you to do basic support mechanisms. We're advising you to drink, eat, do the right things, and all this conversation about what about vitamin C, what about vitamin D, what about zinc. It doesn't harm you, but there is no way CDC or any one of us can say it is recommended. We have no reason to think it helps, no reason to think it harms. Okay, so studies are ongoing on that. So with this, let's move on to Dr. Prerna Roth and ask her the big one. What vaccines? That's the hope. What are the vaccines? What is your experience with all 3 different ones and all of that?
Oh, that's great. So I am so excited for vaccines. As you guys know, we have 3 available in the United States. And I don't know how many people from India are on, but there's also the Bharat, I forget the name. There's Biotech, Bharat Biotech available too. So let's talk about the 3 big ones in the United States. So as you guys might have heard, there's to me in the medical field and scientists, there's no concern that any steps were skipped. All the steps were done to test, the test tube, the animal studies, the human studies, phase 1, phase 2, phase 3. The only reason that it got done so fast is that instead of doing it one at a time, we did everything all at once. And also people worked really hard, like just me and my team, like instead of like doing 9 to 5, we worked day and night. And so if all government officials and all scientists were working 24 hours a day, then of course everything gets done faster. Anyhow, so all that to say, I want you to be confident in the results of the studies. I think they're sound. So top 2 that have been approved for, since January of this year, I want to say Moderna and Pfizer. What the studies did is that both of these are messenger RNA-based vaccines. So what that means is that we take the part of the virus that encodes the spike protein and we inject that. And what that does is makes your body, so it's not the actual virus, it's just a small part of the virus and just the genetic sequence, I shouldn't even say part of the virus, just the genetic sequence that codes, the spike protein, and then our body makes the spike protein and then we recognize it. So then when the real virus hits us, then we're immune. Our body's already like, whoa, we've seen that before, and it kills it. So messenger RNA is a new technology, but it's been working really well, better than other vaccines, in fact. So the Moderna and Pfizer studies both are equally good at preventing symptomatic illness at about 95 to 97% efficacy. I think the numbers are 94.1 and 95%. And that's after you have your 2 doses of vaccines. Even after 1 dose, your efficacy of preventing symptomatic illness is still in the 80s, like 84%, I think 70 to 80%. So even 1 dose is really good, but 2 doses, you're up in that 9, and that's way better than flu, which is 50 to 60%, and we take that. So it's very good vaccine, and I highly recommend it. And Johnson & Johnson, that's the newest one, got approved in March, single dose. So that one is slightly different because it's an inactivated vector-based vaccine. So it's just a different way of saying that we're gonna. Sorry, I'm blanking on exactly how it works exactly, but I know that it's an inactivated vector vaccine. So we just take an adenovirus and put a little bit of the COVID in there, and then it is dead though, so it can't really replicate or anything in your body. And that one's about 72% efficacious at preventing symptomatic disease.
Yeah.
Oh, there you go. So,
Yeah.
so that 66 that's up there. So that's worldwide. If the studies found that in the United States, it's actually 75%. So averaging everything around, it's around 72% effectiveness. So all three of them are very good, very good. I highly recommend. And almost no side effects. I honestly think the kind of body aches and chills that some people feel after getting the vaccine, that's just a sign that your body is doing what it's supposed to do. It's mounting the immune response, and it's way better than if you actually get COVID. So having that one day of little bit of muscle aches, a little bit of slight fever that not everybody has, but if you do have it, that's completely normal. And that's just your body responding appropriately. It's nothing to worry about.
So I'm always amazed at how much, how inspirational the science is, the science we're talking about. We are talking about designing mRNAs that we give people, which tells your entire immune system to produce a certain antibody, right? Imagine, that's the remarkable thing. And that mRNA vaccines are the two, about the Pfizer and Moderna, and such remarkable results. And then as for the adenovirus, you absolutely mentioned it, right? You said it was a shell protein from the adenovirus. The spike protein is included in it so that the human body responds to it as though we've gotten a full-blown infection. And 100%, I want to emphasize the point, in all three of these, there is not a particle, let me say, the virus is not there. So you cannot get COVID-19 from these vaccines, period. Because the mRNA vaccines are nothing but a chain of protein amino acids. That's it. You cannot get it. There's no virus in it. It's an mRNA messenger to your immune cells. You can't get it from there. As for the adenovirus, it's carrying a tiny portion of the spike protein. So at the worst, you might get an adenovirus infection, which there is no reason to think it does. And adenovirus is your cold at the worst. So even then, even hypothetically, it cannot cause you COVID. What I'm trying to do is emphasize the point that these vaccines cannot cause COVID-19. They will mount your immune system. They will tell your immune system to react and produce antibodies as though you had COVID-19. So I just wanted to emphasize that point. And good point about the three vaccines and their efficacy rate. But pretty much for an average person to getting severe disease, we're pretty much 75% guaranteed at the worst, with Johnson & Johnson being the one with the lower numbers for us. Well, that's a big number, right?
Yeah. And I should also add 100% effective at preventing death. So nobody who got the vaccine in the trials died.
From COVID-19, yeah.
From COVID-19, correct, yeah.
Yeah.
So
yeah, so that is such a remarkable number, because earlier I was talking about the number of people that will be dead by, or CDC modeling suggests might be dead by April 10th. They said close to 3,000 people might be dead, additional 3,000. But none of them will die from the vaccine. They would have died because they didn't take the vaccine or did not have access to the vaccine. So the problem is not going to be the vaccine. The vaccine is safe, right? Pretty much, Nancy, Minu, all of us agree. Nancy, how do you talk to people who says they were developed too rapidly and they got emergency use authorization? How do you reassure them about that this is a safe thing, this is okay to use and take?
Well, like Dr. Roth mentioned, it definitely has been tested, but it was just tested pretty much simultaneously. And that's why we have the information that we needed to proceed forward. I think there should be confidence that the FDA is not going to give out products to the entire nation or even the world where you're going to have to worry about it affecting your DNA. It will not affect your DNA. It is fairly safe. Of course, there are things that we need to look for long-term. That's always there. That's with any medication, any product that's always released. So it's not something, however, that we feel is unsafe at this time. And it's definitely safe to use.
Now, going along these lines, somebody has asked the questions considering the efficacy rate, considering the side effects, is there one that you prefer, Nancy? The Pfizer, Moderna, or Janssen? Is there any one of them?
They're all very different. And so therefore it's really hard to compare, just because Pfizer and Moderna, they were tested without the variants in the population. Johnson & Johnson was tested when the variants were there. So if you look at the efficacy rates, that's going to be different because of that. You're also looking at more of a mRNA type with Moderna and Pfizer versus one that's vector related. So once again, it's very hard to compare. And I think the similarities as far as reactions are once again the usual, where you might have some sort of site injection reaction, fatigue, fevers, chills. But once again, you want that. Not to say it makes you feel good in any way, but at the same time, you want your body to respond to the vaccine. So those type of reactions are expected. Of course, those people that may have had any form of allergic reaction to any vaccine in the past should definitely talk to their provider before getting the vaccine, just because there have been cases reported in both Moderna and Pfizer with some form of allergic reaction, and that once again is usually related to people that have had an allergic reaction to a vaccine, food, particles, anything like that in the past. So once again, I would advise them to talk to their provider before getting those type of vaccines.
Prerna, do you seem to have a preference for any one of them for your patients?
No, I just tell them, just get the one you can get first. I think all of them are, good. And the key is just getting it in your body as soon as possible. So that's what
I'm going to ask you another aspect of that question. You yourself have said Pfizer at 95% efficacy, Moderna at 94.1. And then you tell me 66% global for Johnson & Johnson. And then you tell me 76% in the United States, because obviously they didn't have the added disadvantage of the South African variant. How does one in the audience reconcile that I should accept the 75, 76% as an acceptable number?
That's a great question. So those numbers are preventing symptomatic illness. All three of the vaccines are very good. I think 100% effective at preventing both hospitalization and mortality. So, the slight decrease in symptomatic illness to me is inconsequential, because the biggies, I don't want to be in the hospital or die from COVID, are equally effective against all three. And there are some benefits for the Johnson & Johnson. It's a single dose vaccine. Some people seem to have less side effects to it than the Pfizer and Moderna. So in my mind, if you can get the Johnson & Johnson before the other two, I would just go for that, honestly. And it's more widely available because it doesn't need the 32 or the negative 76, whatever degrees. The Johnson & Johnson's only at regular refrigerator temperature. So it's more widely available and is, going to be out there. So I personally think like the big outcomes are equal amongst all three. So I would just take whichever I could get first.
What about you, Meenu? Any preference on either one of them?
No, I totally agree, as both Dr. Patel and Dr. Roth mentioned, really, whichever people can get first. And some people might prefer one shot over two. So I think totally fine for them to receive either of them, seriously.
Yeah. So personally, I would agree with all of you, of course, that all three vaccines are good. There is advantages and disadvantages too, but none of them is to the point where it should be a make or break decision kind of reason. I think there's advantage to Johnson & Johnson because refrigerator wise, you don't need the strict refrigerator temperature maintenance. So chances are when you get the vaccine, there's less likelihood of getting the an inactivated vaccine I'm thinking of conditions like in India or in third world countries. It is impossible pretty much to guarantee a minus 76 even in a refrigerator. That is going to be hard. So for people like that, something that can be stored at refrigerator temperature will have an absolute advantage. situations where accessibility is hard. So let's say I am traveling to a rural area, even in the United States, to vaccinate people. It is easier for me to vaccinate one time, right? Give the Johnson Johnson, be guaranteed no death, no severe illness. I'm protecting the patient against the ICU. And then maybe, who knows, Johnson and Johnson after their trials might tell us to get 100%, we might need a second Johnson. We'll do it if that's what comes down later. But right now, that might be the advantage of Johnson and Johnson, to get a large number of people the vaccine and be guaranteed that it's easy to transport and to dispense out. Pfizer has the big advantage because it was the first one approved. So that's the big advantage there. They've got the most data. The other advantage I find with Pfizer is children over the age of 16 can get it. So that's a big advantage. Moderna also has the advantage. Refrigerator needs are less, even though you have the 2 shots. The efficacy rates are there. So each one has got this nuance where it is superior to the other in some ways, inferior to the other in some ways, but all 3 are good. Right now, if we get even one vaccine of all 3, we're ahead as compared to no vaccine. We are definitely ahead. We're definitely ahead. Even the Pfizer at 1 dose protects 70% from getting the severe infection. So even 1 dose Pfizer is better than no dose Pfizer. Yeah. Okay. Then the next question is, somebody's asked the question, I was infected with COVID-19. This is for you, Nancy. And they want to know, do I still need to get the vaccine? I've got my antibodies. Why do I need anything else? Yeah.
Yes, you still need to get the vaccine. And that's because we really don't know what type of response that you have, your immune system, generated. So, it may have been a mild response, it may have been an adequate response, but it's really just important to, yes, go ahead and get the vaccine, even though you have had COVID. We don't know how long the antibody response that you've had lasts. So it's a good idea to go and get the vaccine.
Yeah. So I was listening to somebody, and that logic that they said also made sense. So I might share that. Somebody said, we've gotten colds, which coronavirus is in the same family, and we've never developed immunity to it for long, right? You get the cold next year again within 6 months. So chances are even the COVID antibodies are here, but the antibodies may not last long enough from a natural infection. And so vaccination would be a good thought there. Yeah. This is an outlier question. How long do you think, Prerna, the antibodies given or produced from a vaccine will last? You think a lifetime? A few years?
Not a lifetime. We know that they, in general, are lasting about 6 months, hopefully longer than that. Most infectious disease doctors think maybe, hopefully 2 to 3 years, but there's a possibility that it'll wane and we might need to revaccinate yearly like we do for the flu. It's just yet, we know minimum at least 6 months. Pending your own body's immune system. Like if you're immunosuppressed, it might not be as strong, but a regular immune system, at least 6 months, hopefully 2 to 3 years.
Yeah, and the hope is that if we have enough number of people, 70%, right? That's the magic number, the herd immunity. We get 70% of people vaccinated, and the virus doesn't get a chance to infect the population of the world, not just United States, of the world, then there is hope that we may not have to vaccinate again because the virus doesn't have the ability to hit us. But on the other hand, if it becomes something that stays in, say, a corner of India, and every time I travel to India, which I do every year, and I bring it right back to the United States, then this cycle will go on, and which means we will probably need a COVID-19 shot every year, every 6 months, every 2 years. We don't know where that math lies. Yeah. Exactly. So yes, the answer is, I guess, we don't know. We hope. Yeah. Is the vaccine safe, Nancy, for pregnant women? What is the situation with them?
So most of the studies, and you can, verify this with even just regular medications, we don't usually test on pregnant women just because of the moral and ethical reasons with the fetus and the baby. So we don't know if it's safe. I think that's something you need to speak to your provider about before getting that vaccine. If you are pregnant, we just don't know. There are pregnant women that are getting the vaccine, and Dr. Roth, you can comment more on this as well, but right now we just don't know.
Yeah, if that's okay, I'd like to. So I
Yes,
just adding
please.
to that, yeah, definitely pregnant women weren't included in the trials. They did include 18 pregnant women that didn't know they were pregnant by mistake, and those people all had okay outcomes, like no fetal congenital malformations or adverse pregnancy outcomes. And then also since then, pregnant women have been voluntarily getting the vaccine. And so we have tens of thousands of pregnant women who have gotten the vaccine, and that data is coming out shortly, but so far, very good outcomes. I don't know the exact numbers, but very good outcomes in terms of safety of the vaccine. ACOG has recommended, ACOG is, I don't know what it stands for.
College of Gynecology, essentially. Yeah.
Perfect. They are recommending that pregnant women go ahead and get the vaccine because the risks of COVID infection itself. So if you're pregnant and you get COVID, you do worse. So the risks of COVID infection itself outweigh, are more than the risk of getting the vaccine. So ACOG and other OB/GYN societies are recommending that pregnant women go ahead and get the vaccine if available. So of course, talk to your OB about it, but I think that it's safe, and based on my experience, and all of my pregnant female colleagues have gotten it. So,
So firsthand research did it. Right. So what I'm hearing from the two of you is pregnant women, if they get COVID-19, the outcomes are worse. So even though there is no research that says that it is safe, but we don't think it's any worse till we know the data from the studies. We think pregnant women should get it. ACOG, the American College of Gynecology, has recommended. So that's like a body that has probably done some thinking about this topic. So we think yes. So as for somebody asking that question, my wife just conceived, can she take the vaccine? We would recommend what ACOG has recommended, and the answer is yes. Does the vaccine cause miscarriage?
Not known. So some OBs are saying that, I don't know if that's directed at me. Some OBs are saying wait till your second trimester because the risk of any kind of miscarriages is usually highest in the first trimester. And people forget that miscarriages happen very frequently anyway, but just to take the vaccine out of the question as the causative agent, some OBs recommend to wait till your second trimester till you get the vaccine. But in general, it is not known to cause miscarriages, correct?
So as for the audience member that asked the question, if your wife has just conceived, we will follow the ACOG recommendations of waiting till the second trimester to get the vaccination. Yeah?
Yeah.
Now, this is an interesting question. Somebody has asked, I have kids going to school 5 days a week with teachers and school staff being vaccinated. Is it still safe for my kids who are not vaccinated, but the staff is not taking precautions because they are vaccinated? So the question there is, what do you ladies think about the teachers are vaccinated, so they're being a little less cautious, and the children are not vaccinated, and the parents of these children are probably not vaccinated yet if they're in the healthy category? Yeah, what do y'all think? Prerna, any thoughts on that?
Yeah, well, I talk a lot, so my personal thoughts are, so I think that it's safe. So kids overall get very mild illness. So I think if the adults are vaccinated, and in the Greenville County school systems, I go to these meetings and everything, and most of the cases that are in the school systems are amongst the adults. They're not really amongst the kids. So I personally think that even if the teachers are not taking all 100% precautions, the way that the school systems are set up with masks and lots of hand sanitizer and plexiglass and everything, I think if those precautions remain in place, it's safe to send kids to school. I also believe that in school in-person teaching is very important to children's growth and development and socialization. So I have a personal bias of leaning towards in-person school in general. So feel free to chime in, but yeah, I would go ahead and say it's safe.
So I would suspect Nancy and Minu probably chime in on that one, right? On the same thing. The next question for us, Minu, was the question of, if somebody's child is 16, what vaccine would you recommend?
Yeah, I think Pfizer is the one, Vinita. And honestly, I really just learned that recently. So I have not particularly recommended that. And I don't know how much it's happening right now. Would love your thoughts on it or others. So from recommendation perspective, it's definitely Pfizer is the one that I believe is recommended. So any further thoughts that you might have, please add.
Nancy, you any particular thoughts about it? Really, let's talk about children and vaccination, because that's probably on the minds of a lot of the parents, because well, they're vaccinated, and we know children are really not the high risk category here. But still, as a parent, you feel guilty that your child has not had vaccine. What's going on with child vaccination? Children.
So I know that they are looking into children, and the studies are ongoing from 12-year-olds and up. I believe that hopefully we'll have that data soon, and a vaccine may be eligible for children 12 years and older, starting probably August to fall, and then maybe younger children. I think that would be later on this year and early part of next year, actually. So I think it's a lot easier when you have a 12-year-old than it is to have a younger child be tested. But for right now, the studies are ongoing, and we're just waiting for information on that.
Yeah. The next question is also interesting. If somebody is allergic to nuts, eggs, are they still okay to take the vaccine? Minu, your thoughts on that?
Yeah, to my knowledge, for sure, Vinita, I think
Yep.
the safety is there if there is, allergic. And yeah, and I would just put my plug for what Dr. Roth earlier mentioned about the schools and the teachers. And I think, with the precautions, it's quite safe, and it is more important for students to be around, their friends and learn from the teachers, but with all the precautions. So,
Yeah.
yeah.
You make a very valid point. There's probably more troubles happening because kids are not in school. So as for that previous question, the very valid point that you make, that it's more important for the kid to be in school than for us to panic that the teachers are not as careful, because I think we will be okay. But the kids need to be in school for many reasons. How do I get vaccine? Where do I get vaccine is another important question everybody's asking. So there is a slide on that on the slide presentation that Sanjay had made that was very valid of how and where we can get it. And not only that, Prerna, you had some data about this. So would you like to talk about that, Prerna? Who can get it, where they can get it?
Sure. Yeah. So who can get it? So you can see right now we're in phase 1B. So anybody age 55 and older, and anybody who has one or more medical conditions. So the CDC website has a list of all the medical conditions like diabetes, heart disease. I don't know exactly which ones, but you can go to the CDC website to see. And anybody who is working in person. So the DHEC website is very clear in that it says you determine if you have an occupational risk. It's not like only grocery store workers or only Lyft drivers. It's if you feel that you're at risk because you have to interact with people less than 6 feet apart at work, then you can click that occupational box. In terms of where to get the vaccine, so there's many sites. It's quite difficult sometimes to figure out where to get it. So if you're not in a big rush, you can just check like the big three, like CVS, Walmart, and Prisma. So this is DHEC's vaccine locator. If you type in your zip code, it'll come up with a bunch of like places where you can get it, and then you can just check the top 3 or top 4 closest to you and see where to get it. But it's fairly simple. You just have to, there you go. There's a list of all the places you can get it. So you just, there's usually websites if you Google it, and they'll have sign up, links, and you just fill out your information and then get it. And I think it's fairly available. It's not like on very severe shortage. So it might be a couple of weeks before you can get it, but you'll be able to get it.
So the point that we're learning is we're in the 1B phase, and anybody that is over 55 can get it, just because you're over 55, or if you think your job puts you at higher risk because you have exposure to people.
Correct.
You cannot work 6 feet apart or something of that nature. So it's really 1B is pretty much the beginning of the mass vaccination period. And it started as of March 8th in South Carolina, and plenty of pharmacies and For the Indian IAG subscribers, we had a drive last week with the pharmacies giving out. There's 3 big pharmacies that we know that have worked with us: the Reedville Road Pharmacy, the Best RX Pharmacy, Malden Discount Pharmacy. Reedville Health provided us some vaccine, the J&J vaccine on March 14th. There was a major vaccination drive at the Vedic Center, very successful one. So that was that's remarkable. Kudos to IAG for arranging that and making it happen. We also have more vaccine from the same 3 providers: Reedville Road Pharmacy, Best RX, and Malden. All of they have presently J&J, but don't forget, you can get the other vaccines from all these other sources. The 3 big hospital systems: Prisma, Bon Secours, ANMED, Spartanburg. Let's not forget Spartanburg. 4 big systems that are vaccinating right, left, and center. The big pharmacies, the CVS, Walgreens, Walmart, the Costco's, the Sam's, the Publix, the Harris Teeters, Ingalls, unending list. So getting a vaccine starting now is about to get easy. So don't panic. The key is wherever you get the vaccine, get it. Even if it's J&J, get it. The reason is you can always come back and get, if there's recommendations that we should get a second J&J, you can come back and get it. If you can get a Pfizer, go get it. If you can get a Moderna, go get it. All 3 are good. All 3 are fairly effective, very, very effective, remarkably effective. And as we mentioned earlier, the other vaccines like like for tetanus and for measles and mumps, if you compare them against COVID compares very well against all these vaccines. So just keep that in mind. So we'll go for it, get the vaccine wherever you can get. And if there's more questions, now there were questions about travel, international travel. I saw that on the chat come through. Somebody had asked, what about travel, international travel? Nancy, do you want to take that question? What would you recommend for international travel at this point?
Sure. So I would tell you to technically refrain from international travel unless it's absolutely necessary. And that's because even though we may have vaccines here and you might be vaccinated, you don't know the country, especially, and how their vaccination rates are. So you can continue to technically transmit the virus depending on where you go. So for right now, it'd be advised that you just refrain from travel. And, you know, a lot of times I think we give these suggestions, and you got to also understand that the world is not perfect and that the recommendations are going to change. So what we say today may change tomorrow. And that's not because we want to lead you in a different light. It's only because we're giving you what we know today and for right now. So for right now, in this moment in time, it'd be advised that you not do any form of international travel until we get more people vaccinated and the risk of transmission is a lot lower.
Good. Thank you so much for that. So obviously a lot of the audience is thinking of traveling, and of course the young ones are thinking of going on spring break. I would use what Nancy said as cautionary note. Prerna, you answered this on the chat and I will read it out. Somebody asked, when will be a good time to get COVID positive person to take the vaccine? So if you're COVID positive, Prerna responded, it said, wait at least 2 weeks after recovery from your COVID infection and up to 90 days as per CDC guidelines. Then the next question is a little bit tricky one. What is the effect of new variants on the younger population, like kids and teens? Prerna, would you like to take that?
Yeah, I think the new variants, like I said earlier, I think it just means that we might have surges in terms of number of cases. So teens, and they might be more likely to get the infection. But if we use standard precautions, hopefully it wouldn't be bad. And as we get our population vaccinated, hopefully we can mitigate any surges. So yeah, hopefully not much.
Okay, so that's good to hear. Now, there's a few questions about the financial end of all this that people had asked. People had asked, if I don't have insurance, if I don't have a state ID, can I still get vaccine? And the answer to that is yes, you absolutely can get the vaccine. When you go to register for any of these vaccine administration sites, it does not ask you for a state ID or insurance, and especially at the pharmacies like Best RX and Reedville Pharmacy, and then Malden Discount Pharmacy. You can check with them. the government of United States is sponsoring and is paying for all people that are in the United States at this moment. So it should not be a problem. The next question was, does insurance company pay for the vaccine? The insurance company really does not have to pay for the vaccine because the government of the United States is sponsoring this. The only part the government does not sponsor is the administration fee. So your provider may charge you an administration fee, which means if you go to, say, Prisma and you get the vaccine and they bill your insurance for the administration fee, there might be a charge. But after so many thousands of people getting it, I've not seen Prisma do that. So I don't believe there's going to be a financial liability to anybody. Yeah. The next question was, somebody's parents are visiting from India. They don't have a social security card and an ID. They have visitor's visa. Will they be eligible? And the answer is probably yes, but check with BestRx, Malden Discount Pharmacy, and also check with the Reedville Road Pharmacy too. Yeah. And the last question was a very interesting one, because I know we're going over time, so I'm going to wind it out with this question. One of my colleagues told me, this is the question, that mRNA was used in these vaccines. Will it alter my DNA? And therefore, is it safe for me to take the vaccine?
So it will not alter your DNA. The mRNA is just a message that it is to your body and to tell you to make antibodies to a specific message. So it will not alter your DNA. It is safe. The mRNA technology has actually been studied for decades, even though we don't really have a vaccine like that. It still has been studied before. So it's not something that's totally new to medicine. So it is very safe. It will not alter it. There are actually viruses like the HIV virus that will actually alter your DNA, but it has a specific enzyme to do that. So the mRNA does not have that enzyme to go and alter your DNA. So you do not have to worry about having that be a problem.
Any thoughts on that? Yes, please.
Yeah, it's also very quickly degraded. So exactly what Dr. Patel said, but even the whatever we do, the amino acids that we do put in, they are degraded almost instantaneously, after the body responds. So it won't be in your body for very long anyway.
But Sanjay and Viju, we think we've covered almost all the topics. Is there any other questions that you want us to address? Otherwise, we feel confident we have addressed most of the questions, and I hope we have reassured most of the audience listening that it is safe to get the vaccine, that it is easy to get the vaccine, it is important to get the vaccine.
Yeah, and I think we covered most of the questions. There was one question coming from Hema. The question was about effects of new variants on younger populations like kids and teens.
I think so. Hopefully, it's possible that with the new variants that kids and teens may get more number of cases, but they won't have more severe disease to my knowledge. And hopefully with masking and vaccines getting around, that we would be able to mitigate those surges so they wouldn't be very high. So that's my hope.
Yeah. So I feel like we've covered all aspects of this, Sanjay, and thank you again for hosting. And Mohit, thank you so much for conceiving of this idea. Thank you. Yeah.
All right. Thank you. And we are 12:06 in our, we are 5 minutes past our scheduled time. So first of all, let me thank you all the panelists. I mean, every time I ask for something, especially for you, Vinita, like you are there always to help us. And this is our second time with Dr. Nancy Patel. She was there on last year at the outbreak of the COVID. Like we did a panel, and that was also very well received by the community. I don't have words to enough thank you to all of you, like Dr. Prerna Roth, Meenu Jindal, because there are a lot of myths, because of all the vaccines that they came so fast and rapidly and all, like, right? So there are a lot of myths, and especially with the social media, it's a lot of things spreading around and all those things. I hope this discussion here, has helped us taking out some of those myths to some of our members. And this is also on Facebook Live, and we will also have this recorded session available on the YouTube for people, the community to go back and look at, because I know some of them may not have made it to this webinar. But again, I'm truly thankful to all of you for taking your valuable time and and being on this panel and giving out all the details, and thank you very much for that. And also thanks for the University of South Carolina a student body, APAMSA, and as well as the Mohit, right? So Mohit could not join us today. He's not doing well. Mohit, I wish you a speedy recovery. But it was he desperately wanted to do this, to spread the awareness within the Indian community. So Mohit, thanks to you bringing that idea to us, and then we are glad we are able to host this webinar. And thanks to my team, Viju Sinha, Vice President of India Association, opening up the webinar and introducing the panelists. And thanks to Priya Palo, who is our outreach member on the IAG committee, helping us with all the technical things on the Zoom. It's not always easy when we do this Zooms, always there is always some glitch and all. I'm glad it fairly went well. And thanks to all of other members who joined for this live discussion, those who joined on the Facebook and as well as those who joined on the Zoom. So you all have a rest of your day, a nice day. It's a sunny day, so go out, enjoy, and please spread the word. I mean, what we are all doing here is we are all doing our small contribution to make sure that the community gets the vaccine. So, and debunking the myths. So you are, whatever the knowledge you have gained, take that back to the community, spread the word, take care of yourself, take care of others, and be safe. Thank you. Thanks for joining.
Thank you. Thank you so much.
Thank you so much.
Thank you.
Really appreciate it.